Hello everyone and welcome to my YouTube channel called 8bin. Today I'm gonna discuss about the Bhilwara model, a model to combat COVID-19. So let's dive in further. Coming on to introduction, well, I hope you all must be aware of the crisis COVID-19 that has affected many parts of the world, be it India, be it USA, China, Italy, Spain, Iraq, etc. And Bhilwara model has emerged as quite a successful one. So we'll be discussing it in detail in our next few slides. Okay, so before discussing the model, let us understand some of the basics of the District Bhilwara, which is a popular textile hub in the state of Rajasthan in India with a population of more than 2 lakhs. The present collector of the district, Sri Rajendra Bhatt, under whom supervision the model was implemented and developed. So why I'm discussing all these points here is that they play an important role in the successful implementation of the model. So let's find out how it became an India's ideal model, which was once designated as India's Italy by the world famous BBC News channel. Bhilwara model or model in madness is an approach that focuses on the following components like lockdown, isolation, quarantine, etc. So we'll discuss each of them in our next few slides. So talking about the lockdown at Bhilwara, they adapted a multi-level lockdown in a city. That means lockdown within lockdown. At the very first level, one can't go out or can't go in the city as the borders were sealed. Then one can't move within the city as there was complete lockdown within the city and ban on public transport. Within that, people were restricted to stay at their home safely and securely. For the same, delivery of essential items at their doorsteps is made available. The next strategy is isolation. The patient tested positive for COVID-19 have been isolated and treated in designated COVID-19 hospitals. Considering each case as epicenter, the area of around 3 to 5 kilometers have been sealed and disinfected daily as per the infection control and prevention protocol. Government has also acquired some of the private hospitals to prevent any shortage of the medical supplies or personnels, if so in future. So the next strategy of screening focuses on the rigorous screening of the individuals by an experienced team, as we know that we are having shortage of the resources, so screening must be very well planned and should be done in phases to avoid any loopholes. Suspected individuals must be kept under surveillance constantly 24/7. Quarantining. Under this strategy, the people who are susceptible to COVID-19 must be quarantined. They can be tourists, migrant workers, or people recently returned from foreign countries. At Bhilwara, multiple team of corona fighters have been made under the leadership of corona captains to monitor the quarantined people. The teams consisted of A&M, Anganwadis, healthcare workers, etc., headed by the captains, which were the districts, DDMs and SDMs. In this way, they have made a total of 4200 teams within a district covering urban and rural population. The food provided to quarantined people was healthy and hygienic and ensured by the Akshay Patra Foundation. For the same, government has acquired more than 6,000 quarantine beds from various hotels, hostels and resorts. The next component of the model treatment. So at Bhilwara, they use a combination of azithromycin and hydroxychloroquine to treat the positive patients, and it was quite a successful story there. Hydroxychloroquine has already been approved by FDA for the management of COVID-19. Further, various researches are still going on to test various drugs and vaccines that are developed to treat and prevent COVID-19. Now, awareness and education is an essential component of the strategy. To make the model successful, it is very important to make the people of that place aware as to why we need to do all this and then to convince them on the same. Then, coming on the interdepartmental coordination, it is very much required as This is a global crisis, guys, so a joint effort is required. Everybody has its own role in this. Even the people staying back at their homes are in a way cooperating apart from the departments like medical, police, bank, etc. Finally, I would like to conclude my presentation by saying this: all the components that we have discussed in the previous slides are important, but the key to success is the implementation of the model. How effectively and efficiently are you going to implement it? Apart from that, I would like to highlight that to copy this model to any other place or area, one needs to be aware that it will require certain modifications as per the requirements, like how many active cases are there, the population size or the facilities and things like that. So this is the timeline of the Bhilwara model, showing the components, how and when they have been used in the model. Like initially they started with the lockdown, ban on the social gathering and screening. Post that, immediately there was a public transport ban. Borders of the district have been sealed. Process to acquire hotels and resorts have been started. On 23rd of the March, more than 6,000 of the rooms have been acquired to quarantine the people and to provide safe and hygienic food. Arrangements have been made. Between 24 to 26 of the March, 5 of the private hospitals have been acquired along with their assets to prevent any shortages in future related to medical supplies. Then isolation of the suspected cases have been done. To monitor COVID-19 24/7, a war room has been set up at collector office. Between 28th to 30th of the March, suspected cases were home quarantined, and to monitor them, a corona fighter teams have been formed, which constitute a total of more than 4,200. Screening of 2.2 million of the population, that was more than 92% of the population of the district have been done, and the second survey got completed within 24 hours, including the test of the migrant workers, which made us conclude that the screening at Bhilwara was well planned, well phased and well coordinated. Then on 31st of the March, door-to-door delivery of food and other essential items have been done to ensure the people staying back at their homes safe and secured. So these are some of the references, guys. At last, I just hope that you like my video. So please share, comment and like on my video, and don't forget to subscribe to my channel called 8bin. Thank you so much, guys.